Excellent. So a couple minutes past 3, I think we'll get going at this point. I just want to say we'll have some Q&A after, but I'm excited to introduce our featured speaker for this afternoon's virtual event, Dr. Pamela Smith. Dr. Smith is a health, wellness, and longevity expert with over 40 years of experience. Dr. Smith has been featured on CNN, PBS, and many other television networks. But before we get to her presentation, I do want to just say hi from Lifelong Wealth Advisors. For those of you that I don't work directly with, my name is Anders Haugen. I do want to, we do have all of our staff on here this afternoon. So if we could, I just want everyone to give a quick hello to those on the call. And so Carrie, are you with us?
Yeah, I'm with you. Hi, I'm Carrie Wickman. I'm the office coordinator at Lifelong Wealth. Nice to have everybody here.
Great. Hello, everyone. I hope you're having a great day. My name is Sierra, and I'm a client services associate here at Lifelong Wealth.
Hey, guys. I'm Logan Taft, and I'm an advisor here at Lifelong Wealth. Glad to have you all with us.
Hi, everyone. I'm Daniel Jandro. I'm a financial advisor with Lifelong Wealth. Looking forward to the call.
My name is Pete Wydowich with Lifelong Wealth, obviously, Director of Operations. I hope everyone's enjoying the nice weather and enjoys this call. Thanks for attending.
Yeah, I'd just like to thank everyone for taking some time out. Obviously, it's a beautiful afternoon, and we'll record this. So if you feel the itch to get outside and take a walk, you know, we won't hold it against you. But thanks again for being here today. My name is Bobby Bonin, and I'm one of the partners and advisors with Anders and Jeremy, and Steve is one of our lead advisors as well. So thanks again for being here today.
I will echo what Bobby said. Thanks for joining us on this wonderful afternoon. We have a number of you on the line as well as joining us via the video. So without further ado, I'd like to introduce Dr. Smith, who is currently the director of the Center for Personalized Medicine and the founder of the Fellowship in Anti-Aging, Regenerative, and Functional Medicine. Dr. Smith was recently the co-director of the master's program in metabolic and nutritional medicine at the Morsani College of Medicine, University of South Florida. She is the author of many best-selling books, which include What You Must Know About Women's Hormones, Why You Can't Lose Weight, What You Must Know About Memory Loss and How You Can Stop It, and What You Must Know About Thyroid Disorders. Her latest books, What You Must Know About Vitamins, Minerals, Herbs, and so much more, and What You Must Know About Autoimmune Diseases are coming soon, as well as her television special that is slated to air on PBS and CNN. So Dr. Smith, I'm delighted to pass it on to you this afternoon.
Well, thank you so much. Good afternoon, everybody. I'm sitting here in Traverse City, Michigan, so I will echo the weather with you. I understand that it's probably 70 where you are. It's 64 here. It's going to be 70 tomorrow, so I don't blame you if you put your head outside the window or go take a walk. We're going to look at some 7 keys for healthy living in today's world to really help you build the immune system, because really that's where it's at now, because COVID is here to stay. It's a virus that is probably not going to go away. So how do you have a healthy immune system? 7 things here harm your immune system. So we're going to go through each of them and talk about the positive aspect of how you can fix it. Stress and anxiety, alcohol abuse, lack of sleep, an unhealthy diet, and a gut that's not healthy, dehydration, lack of exercise, and smoking. So from the viewpoint of stress management, I took these quips and these pictures from a book called Dog Play, which really I love dogs and cats, but the quips were so timely for today's world. So this guy's so cute. Already you're having your cortisol's improved by looking at him. Don't microanalyze every nice breeze that comes your way. If you are too picky, too hypervigilant, it does make you more stressed. You have a hormone called cortisol, which is literally your stress hormone. It's the only hormone in the body that does go up with age. And I'm 66, and that is young nowadays. So many of us will live to be 95 or 100, but we want to be healthy. And a lot of that has to do with how we deal with stress. Cortisol is made by the adrenal glands, the glands that sit above your kidneys. And everybody's stressed now. It's not just COVID, even before COVID. It's a 365, 24/7 world. People overbook, etc. I love this poem from Carl Sandburg. Time is the coin of your life. It is the only coin you have. Only you can determine how it will be spent. Be careful lest you let other people spend it for you. And that is so true. Find some time to carve out for yourself. Another cute looking guy here. I mean, those eyes are just too much. Remember, life is not a busy contest, because it's not. We all get to the finish line at some point. So what does cortisol, this hormone, actually do in your body? It balances your blood sugar. It's responsible for weight control. It's very much responsible for your immune system response. So if you stay stressed, your immune system is compromised. It has to do with bone turnover rate, stress reaction, sleep, protein synthesis. It does decrease inflammation. Almost any disease you get after the age of 45 is inflammatory in nature, including memory loss, both Alzheimer's and not. Cortisol balances the rest of the hormones in the body. When you're first stressed, cortisol elevates. Also, besides being stressed, depression can drive up cortisol. If your sodium's low, if you're inflamed, if you're overweight, it can drive up cortisol. Again, it's about balance. So when you're stressed, again, cortisol elevates, but if you stay stressed and it's chronic, then cortisol goes too low. You have to have cortisol. If you don't have cortisol, you literally die in 7 days. So it's the most important hormone that the body makes. So you have to have it. Chronic stress lowers it, makes it too low. Addison's disease, opioid use, something that's becoming a bigger issue now, chronic marijuana use, Accutane, and steroids themselves. Now, why is this important? There's a hormone that everybody should write down because it's your hormone of memory, or type it into your tablet. It's called pregnenolone, and I'm going to spell it because, of course, it's hard to say and hard to spell. Pregnenolone, pregnenolone. So pregnenolone. It is directly made from cholesterol. And sometimes cardiologists forget this. If you get your total cholesterol below 140, then you don't make pregnenolone your hormone of memory. And pregnenolone directly makes cortisol. So if you stay stressed long term, it doesn't matter what age you are, 25, 50, or 80. If you stay stressed, the body will take pregnenolone, your hormone of memory, make cortisol to keep you alive, and then your memory and focus are not as sharp. By the way, pregnenolone also makes the rest of your hormones, meaning estrogen, progesterone, testosterone, and DHEA, which are important for cognition and other functions in the body. Interesting study showed that as many as 75 to 90% of visits to primary care doctors are stress related. And chronic stress has been shown to contribute to accelerated aging and premature death in actual medical trials. Great looking dog again. Consider Fresh Air God's Prozac. So truly, I was serious when I said, go ahead and feel free to go for a walk. What are consequences of elevated cortisol? A compromised immune system, bone loss. Both men and women can get osteoporosis. Fatigue, irritability. You tend to crave sugar. Shakiness between meals, confusion, memories not as sharp at any age. Low energy, night sweats, binge eating. Your blood pressure, cholesterol, blood sugar, triglycerides go up. You could even develop insulin resistance, which is pre-diabetes. You do have an increase in getting infections, thin skin, easy bruising, muscle weakness. You put on weight, particularly around the middle, sleep disturbances, and thyroid, which regulates your whole body. Everything in it does not function optimally. So what do you do with stress? Because we all have it. Number one, stress reduction techniques are important. Prayer, meditation, Tai Chi, yoga, Qigong, exercise, massage, breathing techniques, acupuncture. Do something stress reducing. I do go to an acupuncturist. I do pray. I personally love to needlepoint. I love to dance. All those things are stress reduction techniques. Also, if you're very wired, calming herbs like chamomile and lemon balm are very helpful, as are what we call adaptogenic herbs. They actually normalize cortisol if it's too high or too low. Ashwagandha, ginseng, and rhodiola. So ashwagandha, ginseng, rhodiola. All of those help to balance cortisol. The world is going to stay stressed, so the most we can ask for at this point is balance. So I'm going to stop now after the first step and open it up to questions.
I have a quick question. How do we, it sounds like you've spent time in the Midwest here. How do we handle the winters with it being dark out at 5 o'clock every night, kind of limiting our normal routine of being outside, exercising, maybe seeing neighbors with everything going on? How, any thoughts on that?
Yes, when I speak under sleep, number one, we're going to talk about what hours you should be sleeping, because that's important. Okay. It does make it difficult. If it were up to me, honestly, I love snow in the wintertime. I love change of seasons, but about January 4th or so, I'm tired of it. And then it would be really nice if the days were longer, it was sunny and it was 70. So I'm with you there. And a lot of it has to do with how much light you get. And some people do get seasonal affection disorder. And if you do get that, you do get a little sad. So the acronym is SAD. And with seasonal affective disorder, some people do need a light at home, but it does matter the hours you sleep as well, which we're going to talk about.
Thank you.
You're welcome.
So Dr. Smith, this is Craig. I had a question. How does all of this relate to maybe preventing us from getting COVID? Because I know that has a lot to do with the immune system as well.
It does. All of these things, all 7 tips, are really related to the immune system itself. It is so important for the immune system. We're all of us are near infections of many. Because of that, wearing a mask is interesting. Because if everybody wore a mask for 3 years, it would actually hurt the immune system, because you have to be near bugs to have an immune system. So we'll see how all of this works. It does cause stress, but if you take these 7 tips and really look at them from a positive viewpoint, many people will build their immune system. So there's a lot to be said for that, because stress does compromise it more than anything else. Let me give you an example of cancer. We all get cancer 7 or 8 times in our lifetime, but there's 2 things that feed it, because otherwise your body kills off the cells. Sugar does, and stress does. So again, it does compromise the immune system. Those stress reduction techniques, adaptogenic herbs are wonderful.
Hey, Dr. Smith, question for you. It seems like some of these things fall out of the traditional medical world. Is there a certain type of practitioner that you would recommend to seek if somebody was interested in helping manage these aspects of supplementation and immune support?
Absolutely. First of all, cortisol is best measured by saliva and not by blood or urine. There are 6 medical trials from conservative medical journals that salivary testing is the best way. And it's not a swab, you actually spit. And it's really good to do 4 tubes, 8 in the morning, 12 noon, 4 p.m., and 11 p.m. So you can see when you're having the most stress. The salivary test, you can get a practitioner to order for you, or you can actually order yourself. It does not require a prescription. And ZRT, Z is in zebra, R is in raccoon, T is in tiger. ZRT Labs in Oregon does offer that to the general public. As far as seeing a practitioner is concerned, you would want to see an anti-aging functional medicine practitioner. Also, compounding pharmacist can order this test for you. They can help you with a lot of the things that we're going to discuss today. So I'm happy to email you over how you would get a hold of people in your area. So please contact either Natixis or please contact your health advisor, and we can get you that information if you're interested in seeing someone.
Yeah, that'd be great. We can maybe work with Eric and send that out after as well. Thanks for that.
Perfect.
I have a quick question. Can you hear me?
I can, Michelle.
Can you hear me?
Yes.
Okay. Yes. My quick question was, is before the alcohol slide came up, you had mentioned several stress reduction techniques and some herbal components that could be used. Can we get a list of those?
I'm sorry, you cut out, so say your question again, please.
Before you put up the alcohol slide, you had listed a list of stress reduction techniques and herbal supplements that could be taken to help with cortisol levels.
Absolutely, we're happy to send those out. Okay, so let's go on to number 2. It's really simple and easy. Alcohol compromises your immune system, so moderation is the key to health. And the reason is that alcohol, honestly, is pretty much liquid sugar. So again, imbibing, it's fine to have a drink, but abuse of alcohol does compromise the immune system. Lack of sleep is number 3. Optimal hours of sleeping are 6 to 8. Believe it or not, if you sleep more than 8 hours a day routinely, that's not good. It is important to go to bed by 11 p.m. or 11:30. If you stay up too late, it changes the circadian rhythm. And the same thing if you get up before 5, because you had mentioned someone did 5 o'clock earlier. Some of my patients say, oh, I'm going to get up at 4:30 and exercise before I go to work. Actually, that's not healthy because it changes the circadian rhythm in the body. That's the natural internal process that regulates your sleep-wake cycle. It compromises your immune system. It can cause depression. It can also increase your risk of cancer, heart disease, and diabetes, actually shown in medical studies. So go to bed by 11 o'clock or 11:30. Try not to get up before 5 a.m. You do make a hormone that regulates sleep. It's called melatonin. But melatonin does so much more. It also builds your immune system. Melatonin has been shown to regulate blood pressure and blood sugar. So low levels do increase your risk of heart disease, stroke, Parkinson's, and cognitive decline. And there's now medical trials that just came out after I turned in these slides showing that melatonin they're using it as an adjunct treatment for COVID because it builds the immune system. We've known for about 5 years now that when you have stage 4 breast cancer, a common treatment is high dose melatonin with or without chemotherapy because it builds the immune system. You can measure melatonin. It is a saliva test, 8 in the morning, 5 p.m., and 3 a.m. with the lights off. It's okay to take a small amount of melatonin without measuring. Men usually tolerate more. up to 3 milligrams, women up to 1 milligram, and then we do need to measure. And the reason for that is if you take too much melatonin, serotonin goes down. When we use these big doses for women with breast cancer, 12 to 20 milligrams, it's interesting when we measure. The levels are not high because the body has figured out that it's using it to build the immune system. So how do people get depleted in melatonin? Alcohol abuse, too much caffeine. Again, it really is moderation. 2 cups of coffee, tea, iced tea a day, for most people are fine. After that, it does leach calcium from the body and it does deplete the body of melatonin. Tobacco, the aging process. As people age, starting at about 65, melatonin does tend to go down. But the number one reason now for melatonin deficiency is electromagnetic fields. So what I'd love to recommend is that you all stay off of your computer, your tablets, your cell phones. After 7 o'clock, you will sleep much better because melatonin will tend to be more normal. And honestly, unless I have a patient in the ER, I stick to that myself. I really don't get on this crazy laptop forever because it's hard on the body. Questions?
No questions, but I definitely have some work to do on putting those devices down after 7 p.m.
I think most of us do. It's a hard one in today's world. And how you
I guess, Dr. Smith, I do have one question for you. I don't know how relevant it is, but we have a lot of clients that are grandparents or parents of kids that are maybe teenage age, and with this hybrid learning that takes place, there's a increased demand for the young kids to be on the devices. Is there a certain number of hours per day that you recommend as limiting the EMF exposure, or is there healthy periods of time where they should get up and move around and distance themselves? Maybe any tips around kind of the new environment that we're in for everybody?
Well, people are starting to study this. That's a great question. Number one, do not put your server in the same room you tend to sit in, because that will limit it. You notice that I don't have, anything sticking out my ear right now because the EMFs then would be right on top of my head. Try not to put your phone in your pocket. Try, and put it elsewhere, set it farther. Here's my phone, but it's not right next to my computer. As far as number of hours, it's hard to say. The studies have shown that now people, because they're on the computer all the time, are wearing reading glasses and regular glasses at a much younger age. We are seeing an increase in ADD, ADHD, whether it's from the EMFs or not, we don't know. So more studies to come on this new or not so new method of learning.
Excellent, thank you.
You're welcome. How you eat does matter. You really are what you eat, and nobody eats perfect. But sugar causes inflammation. And as you heard me say, most diseases after 45 are inflammatory in nature, but it does compromise the immune system. The consumption of 20 teaspoons of sugar per day can literally reduce the immune system by 50%. It also suppresses the immune system from Nancy Appleton's work as well. Dr. Appleton's a PhD. She passed away at a nice age of over 80 in December, but her whole life's experience was looking at sugar. She wrote Lick the Sugar Habit, Suicide by Sugar. They're truly great books at what the body does. When you look at sugar itself, the average American consumes anywhere between 150 to 170 pounds of refined sugar in 12 months. A century ago, the average American consumed about 4 pounds of sugar. So men tend to consume a little less, and about 13% of adults' total caloric intake comes from added sugars. Refined sugar is pretty much 100% calories. It has no nutrients whatsoever. So from several people's work, what does sugar really do? It does feed cancer cells, It can affect how your skin looks, whether it looks younger than your stated age or not. It can promote tooth decay. It can cause weight gain, increase the risk of bowel disease, can cause arthritis or make it worse. It can lead to candidiasis, which is yeast infections. It's involved in gallstone formation, heart disease, kidney stones. If you have MS, which there is a higher rate in the north of the Mason-Dixon line, so in Minnesota and in Michigan both, we do have a higher rate. It will exacerbate it. Can cause insulin resistance and even lead to diabetes. This one's very interesting. Sugar can decrease growth hormone. Growth hormone is the hormone that literally keeps your entire body younger. It can increase systolic blood pressure. When you have your blood pressure taken, that first number is the systolic. It can change the structure of proteins, even impair the structure of the DNA. It negatively impacts eyesight. It does increase the risk of retinopathy from diabetes and also cataract formation. Can cause free radical production. Most people nowadays know what free radicals are. Can cause fatty liver, fluid retention, even constipation. If you hurt your tendon, it does not repair as well if you live on sugar. Sugar can cause an increase in delta alpha and theta brain waves, so it can negatively impact your memory. It can cause depression. Again, it does negatively impact insulin, which is your hormone that regulates blood sugar. It increases fermentation of the bacteria in your gut, so you make more bad bacteria. I'm going to talk more about that in a second. Sugar can cause platelet adhesiveness, so you have an increase in clotting. There's a lot of hidden sugars. Alcohol, again, is sugar. The big one to me that was a real surprise was ketchup. It's about 1/2 sugar. Sugar is used in luncheon meats. Breading many times contains sugar. So does salad dressing, even balsamic vinaigrette. Sugar is commonly added to hamburgers in restaurants to prevent shrinkage. So it looks like you have more meat. So there are some hidden sugars. When it comes to foods, potato, rice, and corn, they're very sugary. Even watermelon is mostly sugar and water. So again, you are what you eat. So your gut is 70% of your immune system. So if you have irritable bowel syndrome, if you have reflux, constipation, diarrhea, gas, bloating, indigestion, your immune system's not healthy. So one of the best things you can do to build your immune system is to help your gut be healthy. So what are some signs of poor digestion? Less than 1 bowel movement a day. Some of my patients tell me they have 1 a week. Undigested food in the stools, foul smelling stools. If you feel better if you don't eat, that's not a good thing. Chronic indigestion after eating. You don't sleep well and you wake up feeling unrested. Frequently cold for no reason. If you're depressed without a reason. A lot of burping, gas, bloating. Need to loosen your belt after eating. An increase in your pulse after eating, and a chronically coated tongue. So having said that, what are some signs of optimal digestion? You should have 2 bowel movements a day. There should be no undigested food in the stools. They shouldn't smell. You should feel great after eating and several hours later. You should sleep well and wake up refreshed, have warm extremities, good energy level throughout the day. At 66, again, that is young. You should still have energy. If not, we can help with that, because from an anti-aging functional medicine approach, there's many things you can do. But one of them is to start with the gut. No extreme food cravings. You feel better after exercising, and you don't have these big mood swings, shakiness, etc., are signs of optimal digestion. If not, you can actually get dysbiosis. Dysbiosis is when your bacteria in your gut, the bad bacteria, overwhelm the good bacteria. And if you have dysbiosis, some of you have heard that this leads to leaky gut syndrome. It does. So we're going to spend a second talking about these because it's so important to help prevent COVID is to have that immune system where it belongs. So symptoms of dysbiosis: nausea, belching, bloating, heartburn, abdominal pain, cramping and abdominal distension, depression, anxiety, constipation, diarrhea, cramps, spasms, gas, even bad breath. But you can have symptoms outside your gut that are still linked to dysbiosis. Brain fog, commonly, and cognitive changes are related to your gut. Anxiety, arthralgias, depression, fatigue, frequent urination, heart racing, phlebitis. Pruritus means itching, skin rashes, almost everything you can think of, acne, psoriasis, atopic dermatitis, they're all related to your gut. Seizures, myalgias, malaise, vasculitis, where you have inflammation of the vessels. These can all be related to your gut not being healthy. So how does this happen? Well, if you eat poorly, if you live on antacids, we want to be able to help people so they don't need antacids in most cases. In fact, when people have heartburn, studies have shown that 40% of people that have heartburn, they actually need acid instead of an antacid. Free radical production, stress can cause your gut not to be healthy, alcohol abuse, non-steroidal drugs, meaning aspirin, Aleve, etc. Antibiotics is probably the biggest one, and viruses. Viruses can cause your gut not to be healthy. And if you get something like COVID or you get another virus, if your gut's not healthy, you tend to get a worse case of it. What other causes? You don't have enough acid in your gut. You don't have enough digestive enzymes. People make less digestive enzymes as you age, but in order for them to work, you have to chew your food. You really should chew it 10 to 20 times each bite. Diminished bile, food allergies are a common cause of dysbiosis. There's two kinds of allergies you can get to foods and spices. The IgE, which you're all familiar with, where if you eat shrimp or something like that, some people that are allergic can get a rash, they get shortness of breath, and they have to go to the ER and have an EpiPen. Much more common is IgG. IgG allergies are different. They're a humoral response, and you don't get symptoms to 2 or 3 days later. And it drives up epinephrine and norepinephrine when you eat these foods or you drink those drinks, commonly like dairy. So what does it mean if epinephrine and norepinephrine go up? You get a high. So you actually get a high from eating foods you're allergic to and an IgG response. So this can cause your gut not to be healthy. Travel, high altitudes, yeast infections, and some people are sensitive to lectins like beans, etc. So what happens if you have dysbiosis? You have a loss of good bacteria. You also have a loss of vitamin production. Vitamins A, D, E, and K are stored in your gut. Biotin for hair and nails is almost exclusively made in your gut. Some of your neurotransmitters go down. 90% of serotonin, the happy neurotransmitter, is made in the gut. Obviously, you get a compromised immune system. You can't detoxify as well because your gut is one of the 5 organs of detoxification. You really don't get the kind of health you should have. And this leads to leaky gut, which is a damage to the lining of the bowel. And you get what we call increased intestinal permeability. So toxins will re-enter your bloodstream. You can even get your medication twice. The good news is all of this is fixable. You can do a gut health test. You can see a compounding pharmacist. You can see a doctor that specializes in this area. And this is 100% fixable. So everybody can have their immune system working well. Common conditions associated with leaky gut are listed here. You all have a copy, or you will have a copy of the slides. I'm not going to read all of them because they're in alphabetical order. And this is just the first slide, and we only got to C. So these are all associated with leaky gut. So we can fix your gut. We can restore it. We remove, replace, repopulate, repair, and go back and rebalance. Because again, 70% of the immune system's in the gut. Questions?
Dr. Smith, I have a question.
Yes.
Some of us have small children, maybe under the age of 7, 8 years old, and probably some grandparents out there for young kids. I know a lot of the stuff I've read on fruit with natural sugars. How much is too much fruit with, strawberries, watermelons, that kind of stuff, or is it just using common sense with moderation? Because I have read some of the things you've talked about where inflammation, soreness, that kind of stuff from, maybe eating too much sugar. So any comments on that for some of us with young kids?
Absolutely. Number one, all my patients, no matter what age, are on 3 things. And I do recommend even 7-year-olds are on a multivitamin, fish oil for their brain. And I recommend probiotics, good bacteria. We even now give probiotics to babies. So we've discovered that having a healthy gut from birth to the grave is one of the most important things you could ever do for yourself, your kids, grandkids, spouse, etc.
Thank you. That was very helpful. Thank you.
You're welcome. Okay, good. There's quite sophisticated testing that can be done on gut health. So the problems are fixable in everybody. There's first-line tests that you can do, which is great. And then there's a new test out of Closmid, which is a lab related to Johns Hopkins, which actually looks at your genomes to fix your gut.
How's the bone broth? Is that a thing for gut health restoration?
It is for most people, yes. Bone broth can help with the pH of the gut because you don't want it too alkaline and you don't want it too acidic. So it really needs to be dead center of normal for optimal health and absorption of the food, because whether it's food or let's say it's nutrients that you're taking, neither one of them get absorbed very well if your gut's not healthy. So one of my patients was taking a massive amount of vitamin D. Vitamin D is very important. It's actually a prohormone, not a vitamin. And it's great for your immune system. It's great for bone health. It's great for memory. And the amount needs to be optimal. It needs to be between 55 and 80 for most people. There's some exceptions to that. If you have hyperparathyroidism or other diseases like sarcoidosis, your doctor would be able to tell you that. But for everybody else, instead of vitamin D just being normal, we want it to be optimal. 55 to 80, because studies have shown that helps prevent breast and prostate cancer and probably other kinds of cancer, and it builds your immune system. But if your gut's not healthy, it's hard to absorb the vitamin D, etc. When you go out in the sun, you get vitamin D, but if you wear sunscreen, you don't get 98% of it. So most of us in this climate need to take vitamin D, particularly in the winter, and we do want to measure those levels. It's one of the most important things you can do. But again, to absorb it, the gut has to be healthy.
Does the probiotic that you recommend for your clients matter if it's refrigerated or not?
Great question. Usually people don't ask me that. That's a wonderful question. It depends on the probiotic. Many of them have to be refrigerated. There's new technology out called spore technology, where literally you have the spores. And so it's a better form of being able to get the probiotics into you. And if it's spore technology, then it does not need refrigeration.
Is there a brand that you recommend that's over the counter?
Well, what I do recommend is, number one, you use pharmaceutical grade. Okay, that means that it's bioavailable, it gets into the body and does what it's supposed to do, and it's free of toxins, because there's no regulation on vitamins in the US. If you're talking about spore technology, microbiome leads the way. You can find microbiome at almost any compounding pharmacy. You don't even have to go to the pharmacy, they can mail it to you. There's other companies that make really good probiotics that are not spore technology. Metagenics, Designs for Health, Orthomolecular. Again, you can find Biotics, Zymogen. You can find these at a healthcare practitioner's office, or you can find them at a compounding pharmacy. Also, places like GNC do carry pharmaceutical grade, and they carry none. And the people there are very knowledgeable. You can go into GNC and ask, and they'll say this side of the store is pharmaceutical grade, or if you're ordering online, it will be the same thing. Just say you want pharmaceutical grade so you get the good stuff, because it does matter when it comes to your health. In order for the gut to be healthy, you to have memory, energy, and all of that, you do have to have nutrients. And starting at the age of 50, your body starts to be depleted in some nutrients. Two, I'd like to comment on, and we could spend all day talking about nutrients, but I'd like to comment on coenzyme Q10, and I'd like to comment on alpha lipoic, LIPOIC acid. Both of those are part of the fueling source for your body and brain. You cannot eat your way into them, and they start getting depleted at the age of 50. So at 50, everybody needs 100 milligrams of Q10, and everybody needs 100 milligrams of lipoic acid, because both of them fuel the brain and, again, the rest of the body. You may need more. Every single medicine that you take causes between 2 and 10 nutritional depletions. So how some people get depleted in all of the nutrients, so their memory's not as sharp, they have fatigue, etc., is their gut not being healthy. Another way is their medications. So we do want to make sure that people understand that it's important to take your medicine. We're not saying it's not. But if you're taking a statin drug, for example, or a beta blocker that ends in OL because you have heart racing or high blood pressure, you're on hydrochlorothiazide, which is a water pill, a diuretic. Your prescription says HCTZ. You're on metformin because you have prediabetes or diabetes. All of those drugs deplete the body of Q10. So at 50, you would need 100 milligrams. If you're on all 4 drugs, you need 100 milligrams for each drug. So yes, you could need 400 or 500 milligrams of some of these nutrients, and that is how you're a young 66 years of age. Dehydration. Make sure that you drink enough water. Now, if you have congestive heart failure or major disease, or your doctor's limited the water, that's different. But for everybody else, water, and there is no substitute for water, is very, very important. 1/2 your body weight in ounces every day. If you exercise 5 days a week or more, then you need even more water. Speaking of exercise, true exercise is working out and doubling your pulse for 20 minutes, 3 to 4 times a week. Aggressive exercise is 5 times or more. If you aggressively exercise, then your body needs more nutrients. It would need 300 milligrams of Q10 and 300 milligrams of lipoic acid. If you're over the age of 50, again, your body does need more nutrients. If you have not been exercising and you've been a couch potato and you're over the age of 40, then please see your primary care doctor or other healthcare provider to get an EKG done and evaluation before you start an exercise program. This last one should be obvious. Believe it or not, some people still smoke. Okay, smoking, yes, can lead to lung cancer, but it certainly doesn't in every single patient. But people who smoke, they do have an increased risk in macular degeneration and vision loss. They do have a dramatic decrease in their immune system, and most people get hardening of the arteries from cigarette smoking. I would be lying to say everybody gets lung cancer. They don't, but those other 3 things are not great. So if you smoke, consider starting a smoking cessation program that will really help build your immune system. So the seminar has provided 7 tips for being healthy in today's world, which really means building your immune system. We want to help with inflammation. Again, almost every disease you can get after the age of 45, it doesn't matter what disease you're talking about, is related to inflammation. A small amount of inflammation heals, too much causes disease. It really is all about balance. Other questions?
And if anyone thinks of anything too after the presentation, send us the questions and we can certainly circle back. And if we don't have the answers in the presentation provided, we could try to connect with Dr. Smith on some of that as well.
Hey, Dr. Smith, I had a quick question before we wrap up, if you don't mind. It's Eric
Sure.
Foster. Can you just talk a little bit about, you mentioned it briefly, but the types of things that we need to be exposed to keep our immune system strong? Can you just kind of, that really caught my attention, but I didn't want to interrupt the flow.
Absolutely. You do need to be near, bacteria and viruses, et cetera, in order to build your immune system. If you stay in a little shell, then your immune system does become compromised. I mean, it's the reason why a pediatrician will literally, say if a little boy is sitting, eating dirt, the mother is appalled. Well, actually, it's part of how they build the immune system. Not that they should live on dirt, but you get my point. Okay. You have to be exposed to bad things to have an immune system. And this is what doctors are worried about now, is that we want people to be exposed to some things. It doesn't mean go stand on top of somebody with COVID. Okay, that's not what I'm saying. But you do have to be exposed to viruses and bacteria to have an immune system.
Thanks.
You're welcome.
Looks like we have one other question here.
Hi there. Can you hear me?
Uh-huh.
I had one question, and that is regarding masks and wearing them. Sometimes you hear that you're wearing a mask and you're touching your face, and it's worse just because you're touching your face and you get the germs and stuff all over. I'd like your opinion on that. And the other thing I want to say is I really appreciate all these tips. We've heard these things for years and years, but you really put them in a nice bundle so that we can understand really how they affect the rest of your health. So thank you for that.
You're welcome. A lot of this will be in my book that comes out December the 27th, called How to Maximize Your Immune System. It will obviously be in much more detail with more references as well. As far as mask wearing is concerned, it is controversial, even in the medical community. And you can see that Dr. Fauci would change his mind back and forth. People think that's weird. It's actually not weird. Your opinion will change as new science comes out. And so we're trying to decide now if masks are for everyone. In all honesty, we don't know. So you may hear different things as time goes on, as the science changes and updates itself.
Thank you.
You're welcome.
Well, we want to make sure we're respectful of everybody's time. We got a little bit of a late start. Maybe we'll just give another minute here and see if there's any other questions. Dr. Smith, was there anything else you had before we maybe say a few comments here to close? Was there anything that you had?
From the viewpoint of being healthy, again, I'm happy to send you a list of providers in your area, or even go in and see the pharmacist, and they can measure your saliva testing and look at cortisol. They can look at melatonin. They can look at your gut if it's not healthy. Again, everything I mentioned today is something that we can either fix, mitigate, etc. You can literally help build the immune system. And we want to work with you on this because some people go overboard. Some people get an autoimmune disease where their body actually is in a hyperimmune state, meaning it's an overdrive. So it is about balance. There's 105 autoimmune diseases. The 105th is chronic Lyme disease. So Hashimoto's thyroiditis and ulcerative colitis and Crohn's disease, and all of those are autoimmune diseases. And so we don't want your immune system in hyperdrive either. We want it to be the perfect balance, where that if you're near something, that you don't catch it unless you're right on top of the person. We want to make sure that people do actually get a shingles vaccine. That's really important. You don't want to get shingles. It's a horrible disease process. We do recommend pneumovax for people who are, either at risk or as they age, certainly over the age of 60 to 65. We do recommend that. And people are, oh my gosh, vaccines are controversial. Remember, I do most of the things I do naturally, but have I had shingles vaccine? I have. Have I had the pneumovax parts 1 and 2? Yes. So it does help the immune system balance. You don't want it on underdrive, and you don't want it on overdrive either.
It's a great summary. Thank you for your time today. I guess I jotted a couple notes down here that I thought were kind of interesting, but sleep, but not too much, exercise, but not too early, and reduce your stress, but not by using your phone after 7 o'clock. So we got some things to work on, but in all seriousness, it is valuable information to have with the winter coming up, and obviously with COVID in front of everybody's minds. We will work on the list of supplements, maybe some anti-aging docs in the area, or how we can get a hold of those if clients are interested. The cortisol testing, you mentioned ZRT, so we can send some information on about that. But again, thanks for your time today. And if there weren't any other questions, I think we can end the call. All right.
Thank you so much, everybody. I appreciate the invitation.